Hello student, how are you? Hope all are well in this pandemic situation. I am your teacher Dr. Mustafa Hussain. My salam to all. Today's topic is eyelid causes of red eye. Trichiasis, irritation of cornea due to misdirection of eyelashes or aberrant eyelashes grow inward with normal eyelid position may result from chronic inflammatory lid diseases like blepharitis, Stevens-Johnson syndrome, burn, etc. Treatment: topical lubricant, epilation, electrolysis, cryotherapy, laser ablation, and surgery. Ectropion, eversion of the lid leads to the disruption of Pierce flow, type congenital, involutionary, cicatricial, paralytic, mechanical. Entropion, inversion or interning of the eyelid, usually lower lid, leads to irritation of the eye. Types: orbicularis, oculi, muscle spasm, involutionary, senile, cicatricial, congenital. Orbital cellulitis emergence. Inflammation of orbital content posterior to orbital septum cause blindness, brain abscess, arises from adjacent ethmoid sinus, Haemophilus influenza, symptoms and signs: painful eye, periorbital inflammation, swelling, reduced eye movement, conjunctival injection, possible visual loss, systemic illness and fever. Treatment: intravenous, broad spectrum antibiotics. Endophthalmitis, intraocular inflammation which predominantly affects the inner spaces of the eye and their contents, that is vitreous and antechamber. Panophthalmitis, acute suppurative inflammation of the inner eye with necrosis of the sclera and sometimes cornea and extension of the inflammation into the orbit. Pain may be severe and globe may rupture. Endophthalmitis, the globe does not rupture. Acute or acute on chronic dacryocystitis. Definition: acute dacryocystitis is an acute suppurative inflammation of the lacrimal sac characterized by presence of a painful swelling in the region of the sac. Etiology: it develops in two ways: an exacerbation of chronic dacryocystitis, acute peridacryocystitis, that is, inflammation from the neighboring infected structures. Predisposing factors: age, 40 to 60 years, sex, female, hereditary, and poor personal hygiene. Causative organisms: Streptococcus, Haemolyticus, Pneumococcus, Staphylococcus. Clinical picture divided into three stages: cellulitis, lacrimal abscess, fistula formation. Cellulitis, painful swelling of the region of the lacrimal sac, red, hot, firm, tender, edema, epiphora, fever, malaise. When treated, resolution may occur, but if untreated, self-resolution is rare. Stage of lacrimal abscess: continued inflammation causes occlusion of the canaliculi due to edema. The sac is filled with pus, distant and its anterior wall ruptures, forming a pericystic swelling. In this way, large fluctuant swelling, the lacrimal abscess is formed. It usually points below and the outer side of the sac due to gravitation of the pus and the presence of medial palpable ligament in the upper part. Stages of fistula formation: when the lacrimal abscess is left unattended, it discharges spontaneously, leaving the external fistula below the medial palpable ligament. Rarely, the abscess may open into the nasal cavity, forming the internal fistula. Complication: acute conjunctivitis, corneal abrasion, corneal ulcer, lid abscess, osteomyelitis, orbital cellulitis, facial cellulitis, ethmoiditis, cavernous sinus thrombosis, septicemia. Treatment during cellulitis stage: systemic and topical antibiotic, systemic anti-inflammatory, analgesic, hot fomentation. During lacrimal abscess, treatment plus drainage of abscess, then DCT or DCR. During external fistula, above treatment plus fistulectomy along with DCT or DCR. Thanks for today. Stay safe, maintain distance, wash your hands, boost your immune system.